Assalamualaikum and hi. My name is Muhammad Danish Daniel bin Rosli and I will be presenting introduction part of our group assignment. So, definition of underwriting is a process used to assess the risk of an individual or group to determine the premium, terms and condition of the coverage. So, underwriting plays a vital role in evaluating an individual risk profile and ensuring they are offered suitable and fair insurance coverage. Next, we move on to the importance of underwriting. So, the first one is financial stability for insurer, fraud prevention, fair premium pricing, sustainability in the long term, and tailored coverage. By analyzing such factors as health history, occupation and lifestyle, underwriters can assess risk and propose plans that balance coverage needs with affordability. Today we will focus on a case study involving Ronnie, a 35-year-old businessman who frequently travels. Ronnie was diagnosed with high cholesterol recently and his father passed away from heart disease. He is proposing an annual limit of 400,000 ringgit with an as-charged benefit plan. Our presentation will analyze this case and provide insight into how underwriting decisions are made.
Assalamualaikum, my name is Medinul Shah, bin Shah, and now I will continue with medical underwriting. So, medical underwriting is used to determine what is suitable PMI products and policy that cover for hospitalization and surgical benefits. It is a process where the underwriter assesses the risk through the applicant's proposal form, which filled by their medical history and current health status. And now we move to the next one, which is the details of medical underwriting. The first one is types. Medical underwriting has four types, which is the first one, full medical underwriting. It reviews the applicant complete medical history through a detailed questionnaire. The second one is moratorium underwriting, which is they impose exclusions on pre-existing condition based on a set time frame. The third one is simplified issue underwriting, which is only a short questionnaire. And the fourth one is guaranteed issue underwriting, which is no questionnaire at all. Now, the second part is current and past medical status. The underwriter will always examine the severity of medical conditions and the possibility of reoccurrence or relapse of the condition or related condition. The insurer is not expected to pay for illness that has occurred prior to taking insurance cover. Now, the third one is basic consideration. The insurer will look into six, which is the nature of the group, age distribution, gender, group size, occupation, and type of benefit and coverage. The last one is special consideration. The insurer also will look into this, such as provider network, past claim experience, health, wellness, occupational and safety compliance, utilization review, and takeover scheme.
For non-medical underwriting, there are many risk factors to consider by underwriter. The first one is occupation. The insurer clarifies occupation based on the likelihood of illness, sickness or injury which affect the risk they pose. This is categorized into four different classes based on the level of occupational hazard. Class 1, this includes low risk occupational. Class 2, this includes supervising or traveling job. Class 3 involves using mechanical driven apparatus, tool or equipment. Class 4, this includes extra hazardous job. The second is gap. The price will depend on the age group or will normally use a variety of age band in pricing. Next is insurance history. The applicant's past insurance behavior review to assess their reliability and consistency in maintaining policy. The key factors include lapse policy may indicate financial instability or lack of commitment. Next, claim history. Frequent or large claims suggest higher risk. And next, coverage gap. Any period without coverage are seen as potential risk. Lastly, a proposed plan. This is to make sure they can afford the insurance. The insurer wants to know if they can pay for the policy without problem. If the person wants a certain coverage amount, The insurer will see if that fits with their financial situation and their needs.
Now, let's connect this insight to Ronnie's case and analyze how medical and non-medical factors influence the underwriting decision. Ronnie's risk profile is shaped by multiple elements, including his medical history, lifestyle, his financial decision, and his previous insurance behavior. This aspect must be carefully assessed to ensure he receives an appropriate coverage while also protecting the insurer from excessive risk. For Ronnie's health risk, it has been shown that he has high cholesterol from his recent diagnosis, which is just 2 months ago. It is uncertain how well he is managing the condition with medication and lifestyle changes. Underwriters must consider whether his cholesterol levels have stabilized or if they are progressively worsening. For Ronnie's family history of heart disease, genetic plays a crucial role in determining health risk. Given that Ronnie's father passed away from heart disease at a relatively young age, Ronnie might be predisposed to similar cardiovascular conditions. As for lifestyle, Ronnie's occupation as a businessman requires constant travel, which presents unique health challenges, which range from dietary habits, which unhealthy eating habits while traveling can worsen his cholesterol levels, lack of exercise from busy schedules and irregular routines, which may prevent him from maintaining a consistent fitness regimen, and stress and fatigue, which may cause from frequent flights, business meetings, and time zone adjustment can contribute to heart-related complications. From non-medical underwriting, Ronnie's previous hospital and surgical insurance policy actually lapsed 2 years ago. This becomes a break from the protection and becomes a critical concern. Besides that, there is a high coverage demand, which his request for an extensive coverage plan suggests that he is aware of his elevated health risk. However, the insurer must ensure that this high limit is justified based on his actual medical needs and financial capacity.
I will continue the last part of the video, which is suggestion and recommendations. After reviewing Ronnie's case, we suggest a policy that best suits his medical needs, given that he is currently under medication. We recommend choosing a policy with the following: advanced treatment benefits to ensure he has access to cutting-edge medical treatment. Next, extended care benefits, allowing him to undergo regular checkup for continual health monitoring. Furthermore, overseas treatment access, enabling him to seek medical care abroad if necessary. So this feature will provide Ronnie with comprehensive healthcare coverage, ensuring he receives the best possible medical support. Next, for recommendation, based on our review of Ronnie's case, we strongly recommend the FWD Medical Plus Rider. We strongly recommend the FWD Medical Plus Rider. This policy provides comprehensive healthcare coverage tailored to his needs. Here are the key benefits: advanced treatment benefits, which cover cutting-edge treatments such as genomic testing, precision medicine, and specialty drugs. It offers an annual limit that doubles in the certificate year when this benefit is utilized. Next is extended care benefits that ensure continuous healthcare support with preventive checkup, includes physiotherapy and physiological counseling to promote overall well-being. Lastly, access to overseas treatment that provide treatment option in Malaysia, Singapore, Asia Pacific, or even worldwide. It is ideal for Ronnie considering his frequent travel. So this policy ensures Ronnie receive the best possible medical care while offering flexibility and long-term support. So that's all for our video, and thank you.